In this module, we will talk about anti-cancer agents, and these are a class of drugs on which, unfortunately, many of us are familiar one way or another, either as patients or as relatives of patients. And so the first thing we should do is define cancer, like we did in the intro video. It's characterized by loss of control of growth, division, and spread of a group of cells, leading to a primary tumor that can invade and destroy adjacent tissues. And the real problem with cancer is when the tumor becomes rogue, goes into the blood vessels, and basically metastasizes at the secondary site far away from the primary site. So when that happens, the cancer becomes invasive, and it is very difficult to control. So local cancers are, in general terms, quite curable. I mean, they're curable, and the rate of survivals are very promising. Have certainly gone up quite a bit in the last few years, thank you to improvement of therapies. Once metastasis has started, though, survival rates are less promising, and that is especially true for cancers that do not respond to specific therapy. And we'll go through that in a second. So how does the cancer develop? Well, we have several mechanisms. In general, what we have is mutations to genes such as oncogenes that basically, when activated, lead to alter control of proliferation, and that it can also be linked to inactivation, tumor suppression. It can be linked to immune systems problems. Like, for example, one of the consequences of HIV infection is the appearance of a tumor called sarcoma kaposi, which is very rare in normal population, but in immunosuppressed patients is relatively common. And so, in general, the cancer, the mutations are either inherited or they're caused by exposure to certain environments. And so the most classic one is cigarette smoke. Link to alcohol is a little less clear. So once the cell starts growing out of control, then we have various cellular changes resulting in situ cancer. In general, more mutations are necessary to evade surveillance of the immune system and other factors that keep the cancer under control in normal circumstances. And then a cancer becomes invasive when it breaks the membrane that contains it, right? So it breaks basically the basal membrane, goes into the blood vessels, and especially in the lymphatic system. And you may have heard of the fact that when cancer is treated with surgically, physicians remove the surrounding lymph nodes, and they make sure or they assess whether or not the cancer has penetrated into the lymph nodes. And in general terms, the more lymph nodes involvement, the more invasive and more dangerous the cancer is. So what are the cellular defects associated with cancer? Well, we have several, and they have to do with misregulation of signaling pathways. So typically, signaling pathways that signal cell division, loss of sensitivity to growth inhibitory signals, and so that's related to the previous one. So we have signaling pathways that may signal for growth of a cell or of a tissue, and then there are also inhibitory signals that keep that in check. We have abnormalities in cell cycle regulation, so that the cell starts replicating out of control. We have evasion of apoptosis. So apoptosis is the so-called cell suicide system. In other words, it's a process by which cells that become rogue kill themselves so that they to prevent damage to the whole organism. And they do that in a very regulated manner that results in minimal local damage. And then also we have limited cell division. A less obvious cellular defect is basically cellular process is angiogenesis. So as the tumor grows, it also needs to spur the growth of blood vessels, meant to nourish the cancer in its growth. And we can, address those processes with certain class of drugs that again prevent angiogenesis. And then we have tissue invasion and metastasis, and again we'll see some drugs that are designed to prevent tissue invasion, so the lysis of the cellular matrix that surrounds cells and keeps the tissues together. And so in order to grow and in order to spread, cancer will need to destroy this intracellular matrix. And metastasis, which is again the process by which a tumor invades the blood vessels and becomes rogue. So let's look at cell cycle. So we have, as a starting point, basically, the G0, which is basically the cell cycle normal phase. So what we have is that in the first phase of the cell cycle, in G1, we have a cellular content being duplicated. Duplication of the chromosome in the S phase. And then in G2, we have a check of the products of duplication. And if those are okay, basically we get on to mitosis and division of the cell into two, and so on and so forth. So typically, cancer is associated with misregulation of the G1 cycle, but also basically of the check point in which the cell decides whether to go into duplication or whether to go into the resting state where cell cycle is stopped. The other place in which we have a problem is G2, where basically if a mistake has been done during this process, then we have defective chromosomes being replicated. And so all the proteins associated with regulation of a cell cycle are called cyclines, and also they're regulated by kinases. So cyclin dependent kinases and are in fact the executors of those of this process, and so inhibiting those kinases results in a rest of the cell cycle. The other process that we can be targeted is apoptosis, again the cell suicidal phase, and so this happens through two processes, one dependent on death receptors, and there are two of them, and that's called the extrinsic pathway. So activation of the cell death, the death receptors results in procaspase production. Caspase, basically procaspases get processed to caspases, and then we have the activation of caspase enzymes and cell death. The production of caspases 8 and 10 in turn regulates the intrinsic pathway, by which basically several proteins inhibit and other proteins facilitate apoptosis. It has to do with the release of cytochrome C from the mitochondrion, and that's one of the signaling, together with APF1 production that forms the so-called apoptosome, which activates procaspase 9 into caspase 9, and again results in activation of apoptosis. The other process that we'll cover is P53 related, and P53 is one of the proteins that is involved in regulating both cell cycle and apoptosis. And so normally, P53 is suppressed by, kept in check by MDM2. When we have cell damage and other abnormalities, we form p53, and in turn p53 regulates the rest of the process for both apoptosis and cell cycle arrest. So misregulation of p53, so inactivation of p53, results in a loss of basically all those activities, and prevents the cellular and genetic stability, which is normally mediated by p53. So p53, in fact, is one of the genes most highly mutated in cancer. So once mutations start, and so the DNA is damaged through mutations that can be spurred by external factors such as UV light and smoke and other things. This DNA damage is sensed by several mechanisms, and one of them we've just saw is p53. And the responses basically include upregulation of DNA repair mechanism, arrest of the cell cycle, and apoptosis. So these DNA repair enzymes are in charge of repairing damage. For example, photolysis reverse UV light damage at the DNA level. Other enzymes basically take out the base pair that has been damaged. So those are the AP endonucleases, and that basically substitutes the damaged base with another one, and so on and so forth. So let's look at the common treatments for cancer. If possible, surgery, and that is direct removal of the tumor, and this is a curative if the tumor has not spread. Then radiotherapy, which is used to control malignant cells and shrink the tumor. This can be done either before surgery to make the tumor more treatable, more smaller. It is also done for tumors that have just started to spread, so they are no more local, but they are regional, and so we have either basically interference with spread to the nearby blood vessels or lymph nodes. In other situations, we can have simply the organ affected. The tumor is no longer contained in the organ affected, but is starting to go into the surrounding organs. And a typical example of that will be, for example, with colon cancer, a tumor that has started to break the membrane of the colon, so can be propagated to the abdomen and can also spread to the lymph nodes. Once a tumor is no more local, we use chemotherapy. This is often done, even though the tumor is still a stage 1, because we are very inaccurate in how well we stage tumors. So stage 1 tumors are considered local. However, it's very frequent that there are micrometastases or other small spreads that have not been controlled. And so chemotherapy targets actively dividing cells, and those are the most brutal treatments because they're less specific. Others use hormonal antagonists, and those are, for example, for the treatment of breast cancer, prostate cancer, uterine cancer, and ovarian cancer, that respond to an hormone, and we'll see how that happens and why. And then the most recent and most elaborate treatment are basically the so-called monoclonal antibodies, which basically recognize a specific feature of that tumor and are able to target it. So drug targets for anti-cancer agents are enzymes, so antimetabolites, and those basically prevent, for example, the synthesis of bases or nucleosides. Hormones, like we already covered a little bit, those are typically for tumors of the reproductive tract, both in male and female. And then we have agents that target nucleic acids, and so we'll see quite a bit of those. Then agents that target structural proteins, and so proteins that basically are involved in maintaining the cell shape, and so targeting them prevents cell division. And agents that target signaling pathways, and that allows us to repair or control the spread of a signal, and those are, for example, protein kinases. And we'll see several examples for each of these classes of drugs.